Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. On the face of it, there is just one word that separates health from healthcare. But between those two terms, there are worlds of difference. And those worlds are correlated with where folks live, how they live, and what their life expectancy is. And community holds the key to so much of that. As part of its compliance with the Affordable Care Act, SSM Health must conduct a community health needs assessment, something it must do every 3 years. The way it's approaching this mandated evaluation, however, is taking the community part of it differently than in past years. Joining me in studio to talk about it is Dr. Alexander Garza, Chief Community Health Officer at SSM Health. Dr. Garza, welcome back to St. Louis on the Air.
Well, thank you. Good to be back.
So community health is a broad term and encompasses quite a lot. When you're speaking about community health, Dr. Garza, you often preface the discussion with a story that is meant to explain the approach to health in the United States very specifically. Would you share that with us, please?
Sure. It's called Searching for Health. It was based on an article that I had written for the Catholic Health Association. And it's as the story goes, a gentleman is looking for his keys on the street. Another gentleman comes along and asks if he can help find the keys. And, of course, he says yes. And then they set about trying to find these keys. And after a while, when they can't find them, the second gentleman says, well, we can't seem to find them. Do you know where you lost them? And the first gentleman says, yes, I lost them over in the dark field over there a ways away, which prompts the other person to ask, well, why are we looking here? And he says, well, it's because the light is better here. Mm-hmm. And so I use that as a analogy for health and health care. People put a lot of stock into the health of the community based on the delivery of health care. And those don't equate with each other. It doesn't mean to say that healthcare doesn't impact health. It certainly does. But if you think about the totality of somebody's life, the majority of their time is not spent in the delivery of healthcare. It is out in their communities. It's where they live. It's the schools that they go to. It's the jobs that they have. All of those different things drive the health status of the individual and drive the health of the community. Mm-hmm. And so in our world, in the community health world, we focus more on those things outside of the delivery of healthcare in order to improve the population's health.
Mm-hmm. So what do you see then as the differences or the ties between health and healthcare? Like if you were to explain this very briefly to someone who's a high school student maybe.
Right. Well, there's a common phrase that's used. It's called the social determinants of health. And so a lot of people refer to that as those are the things outside of healthcare that really impact health. So if you take, for instance, something like education, clearly there are inequities in education here in the metropolitan area across the country. But if you think about what is the natural progression from having a good education means that you are available to go to secondary education, which means you're available to have a good job, which means that you can then have health care, afford good food, live in a good neighborhood, have transportation, all of those different things. Where if you don't have access to those things, it makes it much harder to live a healthy life, to do the things that you need to do in order to maintain your health. Environment is another one. If you don't have a walkable neighborhood, if you live in poor housing, exposure to lead, all of those different things all impact health. Mm-hmm. So we try and have people think much broader than just coming to the hospital or coming to your doctor's office and getting medication. It's all of those other things that really are the big picture for health.
Mm-hmm. I'd like to introduce another voice in this conversation, and that is the voice of Karen Bradshaw, who's Regional Director of Community Health at SSM. Karen, welcome to the show, and thank you for joining us.
Thanks for having me.
So I'd like to turn the same question to you. What do you see as the difference between health and healthcare? And can you possibly provide a concrete example of how that plays out?
Sure. First of all, I come to this work as a social worker, and I started doing individual work with folks in emergency rooms a couple decades ago. And you can see the impacts when Dr. Garza was talking about social determinants of health. 80% of the factors that impact health are outside of getting health care. So exactly what he said, how you live, where you live, who you live with, having interaction with other human beings. One of the things we know is, for example, those folks who are diagnosed with a chronic disease like diabetes. We can see folks in a very acute healthcare setting, in an emergency room, in things like that, who may be struggling to manage a specific diagnosis. Sometimes it may be something medical or a change in medication. More often, it is not having access to healthy food or not having access to food at all. So addressing things like food insecurity becomes a community health initiative. We know that people, regardless if they yet have a disease or not, having access to food greatly impacts health and well-being, the ability to learn at school, all the things so taking on something like food insecurity impacts direct health for those folks that it may impact, as well as community health and looking at that broader picture.
And food insecurity is something that has been taken up, hasn't it?
Yes.
Yeah.
So we have a process every 3 years, which you led to in the beginning, of really identifying needs and priorities. And the last time SSM Health did this, our different hospitals throughout the region, of which there are 8, identify numerous what we call priorities, things like obesity, things like chronic disease management, and various things that we knew were impacting our communities and really restricting their ability to thrive. When we look at those deeper, things like food insecurity impact them all. So as a region, we identified food insecurity. We took a project that started at our hospital in North County, SSM Health DePaul Hospital, called the Bread Basket. And over the last year, we really expanded that to all 7 of our adult hospitals. Now each hospital has an on-site food pantry. Inpatients who are at SSM Health facilities, if they feel safe enough to tell us they're food insecure, will go home with 2 days of non-perishable food for their entire household. And then we really anchored this, as we have to do any community health work, in partnership. So we partner with the St. Louis Area Food Bank for this entire program. All the food that we provide families is from the food bank. And then with the patients that tell us they're food insecure, we make a direct referral to the resource team at the food bank, who work with them once they're discharged to not only have access to food pantries, but also do applications for SNAP and WIC and other programs that can help hopefully move that needle for that individual. And then for the community as a whole, in partnership with the food bank, we host 18 food distribution events. All of our hospitals host at least one. Many of them host more than one during the year. And last year we served, I think, over 9,000 individuals that came through the food. And that, again, is not for our patients. That's for anyone who lives in the area.
Right.
And we feed those families. So this is sort of what comes of this work. When we identify a priority, then we can begin to do the work, not just for our patients, but for the communities where they come from and where they live. And then that part has to always be in partnership.
Right. We'll definitely be coming back to that aspect of community versus patients. Dr. Garza, to what extent is food insecurity now sort of considered to be the purview of a hospital, maybe in ways that they weren't before? I mean, has there been resistance historically to taking that kind of approach?
I don't know if there's been resistance. I think there just hasn't been recognition. So, healthcare is not it's not an easy market to be in on a daily basis, and so people are working hard to take care of the patients that are in their care. But I think more and more people are starting to recognize that these issues like Karen brought up with diabetes or hypertension or heart disease or stroke or all these other things really come from other places. They don't. People just don't naturally have these diseases. They're exposed to other things, such as not being able to be available to or having access to healthy foods, or not having the education to understand that these are the important things that you need to do to prevent disease. So, and then I think in addition to that, I think the community and being able to identify with some of the more social issues that impact society at large have really taken on greater importance. The pandemic really, I think, highlighted that for us when we saw the inequities of who was suffering from COVID throughout the pandemic. Mm-hmm. And so this really is what kickstarted us to be thinking differently about how we approach our communities and how we really reach out beyond the four walls of the hospital to help take care of our patients.
Something that did stand out is the extent to which this is a problem in the United States, right? Advanced country. Other places are not struggling with the same issues in the same way. I mean, to what extent do you think that the ideal of American individualism is sort of a contributing factor to, if you are not well, you should not be relying on community. You're not doing something that you should be doing, i.e., choosing better food and that sort of thing.
Right. I believe there is an element to that. If you look at other countries, so if you compare the amount of money that we spend on healthcare and you look at certain markers, whether it's longevity or other disease conditions, the United States does not perform well. But if you look at how much attention do we pay to the social needs of our community, we don't do as well as other countries that don't pay as much for healthcare. So there's this inverse relationship between the amount of emphasis that we put on taking care of community versus the amount we spend on healthcare. It's almost diametrically opposed, which is very unusual. So I do think that in order for, and I tell our friends in healthcare this too, I think in order for us to really get ahead of that sort of growth curve of the number of people that have illness in the United States, we really have to focus far upstream on those social needs as well. You can't have one without the other.
Now, Karen, in your own work and then looking at public health data, what do you see as being the high priority community health needs in the St. Louis region, apart from food insecurity, which you've already talked about?
Sure. One of the things I would add to your last question as I answer this one is we talk about 20% of what keeps someone well is direct medical care, and 80% are the rest of what we call the social determinants of health. Studies have shown that of that 80%, 50% can be tied back to someone's zip code. And that in and of itself makes it systemic as opposed to individual, right? So when we talk about community health needs, I think in this region, and every 3 years we get to assess to have the community tell us what those priorities should be. But in the past, needs like housing quality, housing affordability, behavioral health services, substance use, these violence prevention. These are things, especially in the city, that have come up in the past. Of course, when you start looking at it, and in the past, I think hospital systems came with a very medical approach. That's where we identified things like obesity, chronic disease, things like that. As this field of community health continues to grow, I think we're leaning more and more into those social determinant of health factors, because that's where we in community health can make partnerships and collaborations to make the biggest impact.
We're talking about healthcare, and community health with Karen Bradshaw, Regional Director of Community Health at SSM Health, and with Dr. Alexander Garza, Chief Community Health Officer at SSM Health. Social determinants of health is something I think many people now at least recognize, even if they're not able to name them. But I mean, to what extent is that already sort of a step in the right direction, and how much more do we need to do to get people understanding what that is, Dr. Garza?
Yeah, I do think that the term has become more and more mainstream, particularly within the healthcare system. I think one of the challenges, though, is healthcare alone cannot address all of the social determinants. I mean, our primary line of business is, of course, to provide medical care. So we do what we can. And so Karen brings up a good point about it's important for the healthcare system to have partners out in the community that do focus on these things. So there's a couple of different ways it can do that with our community-based organizations and with the other partners that we have. But I think there's also some policy elements that have to be engaged as well. Whether that is better funding for education or better funding for job training, things like this. Those are all the upstream things that really impact the social determinants, much more so than what Karen and I do on an everyday basis. We work as hard as we can. But we always have to recognize that it's much broader than just the healthcare sector.
And it's all of that falls outside the beam of light coming from that street lamp, going back to the story. So, disparities and addressing them with an equity lens. I mean, a lens is something that you use to see, right? And disparities sometimes they're not even considered, let alone looked at. I mean, how is it that these disparities are being regarded with an equity lens in such a way that it's going to make some practical difference in what is happening in communities, Karen?
I think I would say that we're learning more every time, right? And as we continue to grow in this work and as I meet folks in other health systems, not only just here in the city, but also across the country, this is a really growing field. And so when we talk about doing things with an equity lens, it is having the habit and the practice of disaggregating data by race, by gender, by age, to really figure out where is the largest disparity, and then often trying to focus there to disrupt, to intervene. I love the verb disrupt, trying to break the systems that are causing it or figuring out ways to address. A lot of the things that we've already mentioned, food insecurity, housing, these are not new, and they are literally centuries in the making. And the history of here in St. Louis, housing policies, school policies, these are all generational. And so unraveling that takes time and takes partnership and takes intention. So I think with that equity lens is always stopping and saying, who's not in this room? Whose voice isn't here? How do we bring that in? Because quite honestly, knowing that community health work, the community are the experts. And so if they're not there from the start, then we have to figure out how to do that. Coming in with public health data is fabulous. It's a great thing to layer in. But learning, if you truly want to engage with communities, then you have to start with community and hearing from them first.
And that gets right to the point that we made in the introduction, that this year, as a not-for-profit health system, SSM Health must conduct a community health needs assessment to comply with the Affordable Care Act. And this is something that has to be done every 3 years. So what is the purpose of this report, and how does community come into this, Karen?
So we'll start with the purpose of the report first. The purpose of the report is really to go through a structured process for each hospital to identify community health priorities. Where are they going to focus time, talent, and resources for the next 3-year period? And the goal has always been to ensure that it's serving community. Again, it goes along with the nonprofit status of wanting to be focused on community and outside just those that we serve as patients. And how this process for every nonprofit hospital system, when anything's new, people do the best they can with the knowledge they have, and when you know better, you do better. So it's sort of been an evolving process every 3-year cycle that even here in St. Louis, SSM included, we've done more each time. In fact, when they first came out, every hospital in this region did it on their own, realizing very quickly we were all asking many of the same partners, people, the same questions, and that gets tiresome. So we now have a collaborative of all the hospital systems to do this work together and keep wanting to lean in to one, having it anchored in community voice, and two, doing this more and more collaboratively. I think the last 10 years in St. Louis, we've learned a lot more about silos and the need for collaboration.
Dr. Garza, I think it was, I don't remember which of you mentioned this, but there are 8 hospitals. Karen, you just said that each hospital did its own assessment. I mean, is part of the problem of approaching community health better, is part of the problem that there are so many hospital systems like in one place, and also like a lot of social work programs too?
Yeah. So I wouldn't say it's a problem. It's a challenge for sure. But I think we've done a lot better. So, you have to take sort of that bureaucratic, understanding that each hospital has to do a community health needs assessment. Now, we recognize that the social problems don't stop at each hospital. It's really a regional issue. And so that's why we've really come together in partnership with the other healthcare systems to do region-wide community health needs assessments. And then in addition to that, we also recognize that the city is different than the county, which is different than St. Charles County, which is different than South St. Louis. So you get a lot of regional approaches to this as well. And that's how we've tried to approach it also is even though we're all one big statistical area,
right,
we have certainly different challenges in each part of it.
What do you think it would take to get St. Louis and St. Louis County and, St. Charles County sort of more aligned? Like, is there maybe one particular area, and not geographical area, but a subject, a health issue that could really benefit from that kind of, consolidated effort?
I really can celebrate that we've come a long way in the 12 to 15 years we've now been doing community health needs assessment. I will highlight that public health departments have to do them too. And again, this could be a policy structure thing. They're mandated to do them every 5 years, where hospitals do them every 3. So it's very hard to align when you have different time frames. But my partners at BJC Healthcare, Mercy, St. Luke's, Shriners, and SSM Health, we have formed a hospital collaborative. And while we're not on the exact same schedule, there's a little bit of a difference. SSM owes a report in 24, and the rest owe a report in 2025. We have agreed that it's close enough that we're doing all of that work to ask community, to be guided by community, guided by our public health partners, community-based organizations, doing that together right now. That has come a long way. I think as we ask questions together, as we listen intently together, that is going to lead to, we already have areas where we have aligned priorities. And we are all very committed to keep aligning and doing that work together, including with our public health partners. We have regular meetings all together to say, we all hear behavioral health needs, substance use needs, things in community. We're asking questions this year a little with our children's hospitals in mind on youth and what are the areas of need for children and youth. As we do this and as we do it together and as those priorities rise based on community voice, it's going to help us do our work closer aligned in the interim between the years too.
So as we close here, Karen, where is it that we can find information regarding the community conversation events that are coming up this summer? And what is the incentive for those, for people listening, to participate in person rather than just online?
Sure. So right now, the St. Louis Hospital Collaborative, we're really trying to set up our process to be anchored in community voice. We have kicked off an online survey right now, available through all the hospitals. I think it'll be on your website as well. That survey is open to anyone who lives in the St. Louis metropolitan area. It takes about 5 minutes. It's available in English and Spanish. It is available on phone or computer. And it's really a high-level survey. We'll do work in between to look at the outcomes of that survey, align it with public health data, get some feedback from those folks who do this professionally, like public health, other community-based organization leaders. But then we really want to, in the July-August timeframe, have community conversations, especially with populations that don't always fill out surveys. I think anyone who's ever done an electronic survey knows that it's predominantly white, upper middle-aged, educated women who respond to online surveys. While that is my demographic, and we certainly are part of this community, it's not everybody. And so we want to focus those community conversations on folks in each area that we're doing them in for populations that aren't often represented in surveys. And so those will be done in person in the July-August timeframe. And again, there'll be information on all of the hospitals' websites on how to get involved.
And people will be compensated for their time and labor. Karen Bradshaw is Regional Director of Community Health at SSM Health, and Dr. Alexandra Garza is Chief Community Health Officer at SSM Health. Dr. Garza, Karen, thank you so much for joining us today.
Thank you.
Thank you.
This episode was produced by Emily Woodbury.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.